neonatal lupus image was there, and there was a statement of retinoblastoma. How is the diagnosis being done? Actually, one catchy thing was retinal biopsy, which is being contraindicated, was given as one of the option. The answer was the ophthalmoscopy. And next, a neonatal lupus mother, what are the drugs which is being contraindicated in the mother who is suffering from SLE? The answer was leflunomide. And Kawasaki atypical, which is the investigation that we don't do, that is ferritin. One psoriatic patient with nail pitting was given. Age under which the ADHD will be diagnosed 12 years. And one clinical scenario was given wherein the child is not attentive to the mother, and mother is not able to make out when the child is getting wet, and that was the clinical scenario. Answer is autism spectrum disease. One clinical scenario of milestones was given to detect the age 4 years. Developmental coefficient of one clinical scenario of a child with different domains of development was given. The quotient was half of that age what they had described. And investigation for a child with intellectual deficit, the next step will be chromosomal microarray. The reference is Nelson. Idiopathic raised ICP, one question was there. Consistent finding is papilledema. And first line of treatment in case of raised intracranial pressure was intubation and mechanical ventilation. Hypertension, the minimum pressure required to call it at least mildly elevated is 10 to 11. Pulmonary wedge pressure with capillary wedge pressure is decreased in which of the following types of shock? The many options were there, like obstructive shock, early late septic shock, and cardiogenic shock. Answer is early septic shock, wherein there will be vasodilation. And congenital nephrotic syndrome gene was given. Answer is NPH2. And ARPKT drug, what is being used was asked, Vaptins. And hyperoxaluria, the answer was autosomal recessive condition with a defect in glyoxylation. One clinical scenario with showing hypocalcemia and hypomagnesemia was there. It was not hypocalcemia. There was hypomagnesemia and hypocalcemia, and there was alkalosis and all. The answer was Gitelman's. And PSGN, there was hypertension with encephalopathy. So, which of the following is the diagnosis was the question asked? Answer was press.